Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to go over the Real Housewives regrets. We thought that it would be interesting to go through. There was a recent article published where some of the housewives went through some of the surgeries they regret having done, and some of them they had reversed. And so I thought there might be some interesting things to talk about there, as well as a lot of people, even celebrities, get caught up in sort of fad type surgeries and follow these trends. And I don't think that's always a great idea. As you always hear me say, don't follow these extreme trends because they can go out of style, or or kind of convince yourself that you want to do it, and then afterward you say, uh-oh, this isn't exactly what I wanted, and then you have to go and reverse it. So we're going to go through some of the housewives and talk about what surgeries they had and what they regret. So the first person we're going to go over is Shannon Beador. She did one of the things I always tell people not to do, which is go and get things or surgery or things injected into your face right before you're supposed to go on camera. Because, there is swelling associated with everything, and if you end up doing that, on top of the camera adding poofiness and weight, you're going to look really poofy, and everybody's going to notice something's different. And that's kind of what happened to her. So she went to a reunion and she had injected her face, and she came in looking really poofy, and everybody noticed.
A lot of people asking, what did Shannon do to her face? As the reunion was around the corner, it was suggested that I try a natural filler in my face and in my cheeks, and I was running out of time. So I said, okay, go ahead and do it without doing the research and without thinking it through, which I usually do. And it's been a really hard.
First rule would be allow yourself some time for swelling and things before you're going to be on camera or going to an event or seeing family or whatever it is. Going back to work is make sure you realize there may be swelling involved. And if you don't want people to know, give yourself some downtime. Allow some time for that swelling to come down. And I think she did, eventually whatever she injected did come down. So if it was fillers, it may have just been swelling. She may have had some of it dissolved. But eventually she was able to reduce that poofy face down to her regular face and look normal again. So next person we're going to talk about is Lisa Rinna. She's one of the Beverly Hills housewives. This topic seems to come up frequently, but it's about her having silicone injected into her lips many years ago. And like I've talked about previously, women that had their faces or lips injected with silicone a long time ago, eventually over the years, 10 years, 20 years, the silicones form scar tissue and lumps, and they start complaining that they have lumps and bumps and hard tissue inside their lips. And that's what happened to Lisa. Then she went to try and have cortisone injected to combat some of the lumps and bumps. The problem with that is it's not going to dissolve the lumps and bumps, but it can thin the tissue surrounding those lumps and bumps, and then it made it look worse. And that's kind of what happened to her. She went and tried to put some cortisone into the lips, steroids, and it got worse. So in her case, though, I think she must have eventually probably had it removed. And you can surgically remove the silicone from the lips.
Just a month ago, Lisa Rinna revealed to Showbiz Tonight and the world she had surgery to make her famous lips smaller. In the upcoming season finale of her reality show Harry Loves Lisa on TV Land, her doctor tells Lisa that he's worried about how her famous lips are healing. This was first seen today on People.com. Take a look.
Not coming together here the way I want it to. I wished it was healing faster than it is, but it's not.
Okay.
Ready?
Yeah.
This could be serious. Lisa could look weird for the rest of her life.
I looked at Harry, it was like, help me. What now what? What did I do? What do we do? I was freaked.
You have to make an incision and literally take out the silicone, so it's on the inside of the lip so you don't see the scar. And then you can replace, if too much volume is removed along with the scar tissue and silicone, you can replace that with hyaluronic acid fillers or your own fat. So it's probably something she did, and now her lips look beautiful. So that's one thing, one little caveat is if patients did have injected silicone into their lips and it did form that scar tissue, it can be removed, but definitely go to somebody that's experienced with removing the silicone. So the next housewife we're going to talk about is Jennifer Aydin. She went to Turkey to do her surgeries, and she had a rhinoplasty and chin implant placed. And Turkey's fairly well known for sort of extreme type surgeries, or can be, so I always caution patients, be careful going out of the countries, and particularly in Turkey, because they do like to do more extreme surgeries there. Some people want that, but again, I warn people that the extreme surgeries are the ones that can lead to complications or things that you don't like or unnatural appearance. And it seems like That's what happened to Jennifer. She went there, she had the surgery. When she came back, she felt that the chin was too big or didn't like what was doing to her face.
The doctor recommended I get a chin. I didn't think I needed a chin. Okay. I got the chin and I hate my chin.
All right.
So I took the chin out.
Okay, let's go.
I tell people any sort of facial surgery can either add or subtract from your beauty. You always want to do a surgery that's going to add to your beauty, not going to become a distraction. And in her case, did she really need a chin implant? It's questionable, but it may have also been that she also went with too large of a chin implant. In that case, it can throw the facial features out of balance. And particularly in women, if the implant's too large, it can give a masculine appearance. It can give the chin, it can become too large. And so in that case, you got to go back and have the chin implant removed. And you can, it's not the end of the world, but also the first rule is try to do it right the first time. So I always tell people, try to avoid those extreme surgeries. Try to not go all the way to one spectrum. Also, a good thing to do is have a doctor that can sort of image photos for you, show you what you might look like before or after surgery, so that before you ever do anything, you have an idea of what your face is going to look like with these new features. And that way, it gives a picture is worth 1,000 words. It gives you a way for you and your surgeon to communicate, and you can say, you know, that's too much, that's not enough, this is what I want, and hopefully you get good advice and don't go too extreme. Next housewife we're going to talk about is Vicki Gunvalson. Like Shannon Beador, I think the mistake she made was doing surgery too close to being back on camera. Not to be a broken record, but it's something that people that are in front of the camera, like I say, or just people that, like I said, are going to be seeing family or friends or going back to work, you gotta leave time for the swelling to come down.
I do regret having my nose and my chin done 2 weeks before filming, like 4 years ago. I thought we were gonna have like a break of 2 to 3 months, and all of a sudden cameras were up and I was like a moon face. I was so swollen and I couldn't move my mouth and it was totally embarrassing. And that's forever on DVDs for the rest of my life. So I regret doing that surgery right before we started filming.
She did facial surgeries, and that facial swelling, particularly on camera, is gonna look poofy and make people look very different. It's gonna be very obvious. In general, not as bad, just, you know, if you're going to an event or doing something else, but if you're gonna be having photos taken of different things, be careful because that swelling can be there. Now, the surgery she did, like the nose, again, that's gonna hold on to swelling for quite some time, you know, months. It may look better than the original nose, but it won't be its best for 6 months to a year. I think she also had a chin implant placed. Again, the chin will heal fairly fast, but again, it can feel a little tight. And also with the nose, it can affect the smile, it can affect the facial animation for a little bit while the swelling's coming down. It won't be permanent, but just for that couple weeks there may be some changes where people will pick up that something's different. Same thing with the fat grafting. It can be swollen, it can be a little poofy. So you want to give that several weeks before going out and seeing people. Give a little bit of time for that swelling to come down if you don't want to give your secret away and you don't want people to know what you did. We're going to talk about 2 housewives now, Emily Simpson and Tamra Judge. Both of them had their breast implants removed. I'm not quite sure if they thought they had breast implant illness or they also just wanted to remove their implants or downsize their breasts. We are noticing a little bit of more of a trend of that. Women want to downsize their breasts or remove their implants. And I think breast implant illness is controversial. But if you're a woman and you're considering removing the implants, I think it's fine. There's no reason, if you feel your implants are causing you issues, not to remove them. You could always put them back if something changed. And secondly, we have some better techniques available. What does that mean? We have fat grafting of the breast now. So women, when they used to remove their implants, were really concerned that they were going to lose all of their volume, their breasts are going to be deflated. And in some cases, depending how big the implants are, you can replace that volume with fat grafting. Now sometimes and I think one of them also did this, is you may need a lift if it was a rather large implant and you're downsizing. But a lot of women like that feel of removing those implants, kind of taking away the matronly look, the top-heavy look, and looking thinner and more fit and not carrying around that weight. So I noticed there are a lot of women that are either downsizing their implants or replacing their implants with fat grafting. And it's a very common procedure to do and very safe. So if people are interested in that, I'm sure there's many qualified surgeons that can remove those implants, do the lift, and or add the fat grafting at the same time. Last housewife we're going to talk about is Sonia Morgan. Now she had multiple surgeries. Some she regrets, some she doesn't regret. And the one that she kind of regrets is liposuction. And I think like all surgeries, if it goes too extreme, people regret it, you know. And I think in general for liposuction, I always encourage patients, Exercise, diet is always a better way to lose fat. And then when you kind of get your body down to maybe 1 or 2 trouble areas, that's when liposuction is really more effective, because you're healthier and you've also uncovered these kind of stubborn trouble areas where you can go in and target that with the lipo, and that way they don't come back as readily. So again, I tell people, try not to go extreme with those surgeries. Liposuction isn't necessarily for weight loss, it's more for sculpting and shaping the body and targeting those trouble areas. One thing, since we want to end on a positive note, is that Sonia also underwent a facelift and rhinoplasty, and I think it was done well. And the reasons I think it was done well is because it looks natural. She looks like herself, just younger, more attractive. And I think one other thing with the nose that I like to always tell people, in her case as well, is that as we get a little older, our noses do continue to grow, or the ligaments weaken, so the tip will plunge a little bit or look bigger and wider. And a lot of times with the facelift, doing that rhinoplasty, that little touch up where we lift the tip, shape it up, define that tip, it will make you look younger and more attractive. So altogether, the overall look of doing that facelift with the rhinoplasty is that she looks good. She looks like herself, she looks younger, she looks prettier. I think it was done very well.